What do you think mental health is?
I don't know, like people have got problems in their head.
Affect someone's mental well-being, like
Yeah.
emotions, if they're happy or if they're sad.
A lot of people perceive it as something where people are mad, but I mean it could be stuff like anxiety. Does that come underneath it?
Yeah.
Yeah, you know, I know my stuff.
It's like the state of your mind, isn't it?
Well-being of the mind.
Yeah, the state and well-being of your mind.
My name is Aisha.
My name's Taba. My name's Tamana.
My name is Ayub.
I'm Jordan. Yeah, I'm Mohammed. And basically why we're here is because we've been asked by Right Here Project to come in and evaluate. But the thing is, we have no idea about Right Here Project. So what we're going to do first is investigate, find out what they're about, what they do, and then we're going to evaluate on how they do it and how it comes across to young people or the general public.
I mean, one of the big things is that the rates of young Black and Asian people hitting extremes or needing extreme psychiatric support and care are much higher than they should be. I mean, we don't want anyone to get into a crisis situation, but what it suggests is that people aren't getting the support early enough to stop them from getting to that point. You know, the only time when people actually go, oh, hang on, there's a problem here, is when it's got so bad for that young person that something drastic has gone on in their life.
And right here is to
Crisis.
kind of
Stop that
from happening and recognising before it gets to that stage.
Exactly.
Yeah.
We are the youth panel.
Can you please sum up in your own words what is Right Here Project?
Nothing about us without us.
That's a very good question. I mean, so how significant is your involvement?
We are, because it's project run, like, I mean, youth led. We are. If we wasn't here, then nothing could be done really, because we make all the decisions. Most of it comes to us before going to anyone else. We're involved in everything. We are the project. Us young people, the young panel, are the project.
One of the good things about the Right Here project is that they give young people a chance to make big decisions. When we were hiring people for the position of community development worker, the youth panel and the filmmaking crew conducted the interviews, and in the end they had the chance to decide who gets recruited.
I think being interviewed by young people is actually, although it's a little bit daunting, it's actually really cool. I think it's a sign of a good organisation if they're letting their young people play a part in the kind of recruitment process. And also it's really good to get an opportunity to meet the young people and get to know them before taking up the new role, hopefully.
Michael, we've got some good news for you, mate.
Oh my gosh. I loved you. You were just so great.
You answered all our questions and you were just phenomenal.
Tell you what, Michael. See you next week. You're going to boot camp.
Okay, I'm going to regret that last bit.
I'm Akifa.
I'm Adiba.
And Akifa and Adiba are well-being champions. And why do you think it is important to use peer-to-peer learning when dealing with mental health, young person to young person, basically? Like, why do you guys think it's important?
Because it helps you relieve stress from the mind. Like, in case someone's having issues in a relationship, for example, it helps them sometimes to talk to someone else, and maybe someone else of their own age will be able to understand where they're coming from. Yeah.
So what do you think, they find it easier to talk to other young women? And
Yeah.
It's like from their own perspective, so they have a better
Why
understanding.
do you think they'd find it hard to talk to people that are maybe older?
Because, I don't know, probably because some older people, not all, but there are a few who tend to be judgmental, so they're going to judge young people as, you know, make it a bit stereotypical, say all young people are like this and like that.
well, would you yourself, like, would you feel insecure talking to someone or older than you?
Not really, but it just makes it a lot easier if someone's your age.
Some people that I know tend to have family problems that, like, other people of a different ethnic origin won't seem to have, such as the culture difference. Some families tend to think it's okay to hit other people, whereas other families from a different ethnic origin would think it's like definitely not going to happen.
We've learnt so much, and it's just about trying to educate other young people and trying to get them to understand, and it will help. It will definitely help, and the project is growing, and it's growing. It's already grown, but it's still growing. Do you know what I mean? So
we interviewed Esther, and we suggested a few areas that right here would need improvements in.
What do you think is more important? A small group of young people that are informed and know a lot about mental health, or just lots of young people that just know a little bit about mental health?
That's a difficult question. Not difficult, because in some ways, obviously, a lot of young people knowing the basics would be good. More important than a few young people knowing a great detail. But the model, the basis of the Right Here project is that a few young people knowing enough to be able to lead that change is the best way to do it.
Yeah. When trying to get the young people involved in that initiative, do you think it's the mental health that kind of throws them off? I think when I first heard about it, I wasn't over the moon about it, but when the whole filmmaking twist was given to it, I was more interested in it. But obviously I didn't know what mental health was, and once I did come, obviously one of the great reasons I came was because of the filmmaking. And when I came and I learned about mental health, I found that a lot more interesting.
I think a lot of people think it's a bad thing rather than a good thing. So I think you need to
mental health?
Yeah, like promote it as a good thing, not
positive
a bad
thing.
Because a lot of people do think it's a bad thing.
We found out, like, if we're not a well-being champion, if we're not on the youth panel, and if we're not part of the filmmakers group, how are young people meant to get involved and be a part of Right Here?
We had no knowledge about it until we found out from another organisation, and through them someone told us, and because there was this event going on. So I think it's just about getting a message across to
getting the word out.
Probably maybe not just to young people, because young people tend to be a bit lazy, or they tend to forget sometimes, there's this organisation, but maybe through like other training providers or schools or something. If you had more young people, just say in the sense that you can find out everyone's strengths and what they're actually quite good at or quite passionate about, and then again, this is another thing that lures them in. It's like, if you're really interested about IT, then do you mind designing a leaflet? And then that's still learning about, and they're doing something they enjoy. In that sense.
Like, if you guys say that you don't have money to, hire more people, you can just use the existing people. If they're interested in doing certain things, you can let them get on with it.
Your friends are more likely to feel okay about talking to someone about their mental health if you guys have said to them, this is cool, it's not a problem. So that's the kind of model that we're trying to get to, is that we empower like maybe a relatively small number of young people, 60 or 100 young people, but that they can then reach other young people in a much better way than we would be able to as sort of older professionals.
Right Here is mainly young people led.
Yes. You're going to have to keep your voice in for that bit.